Okay. All right. So, first of all, I'd like to thank you guys for taking the time to be here today. I'm going to jump right into it. Many of you may know or may have experienced the trend today where healthcare visits are categorized by longer wait times, shorter visits, and sometimes a lack of understanding of, next steps and treatment plans. And there's actually a reason for this. So, the Association of American Medical Colleges identifies that there is a physician shortage that will exceed 100,000 people by the year 2034 in regards to the ratio of supply and demand. There's less doctors, and even so less in specializations as mental health care and women's care. And even more so, the lack of physicians is actually attributed to underrepresentation for the population as a whole. So you might ask yourself, why does this representation matter? Well, an article by Alson titled "Does Diversity Matter?" Finds that better outcomes are, met when healthcare providers more closely share our background, whether that be ethnic or racial diversity, geographic location, or socioeconomic statuses. And this is because communications are improved, there's a stronger sense of trust, as well as adherence to treatment plans and attendance to medical visits. Whereas in contrast, a lack of diversity leads to biases, misdiagnoses, and oftentimes a misunderstanding on linguistic and cultural barriers. So, the data is that among populations such as Black Americans, that represent 13% of the United States, only 5.7% are actually physicians. And identified by the Health Resources and Services Administration in 2023, the rural population, which is actually 1/5 of the United States, represents less than 5% of upcoming medical students. And these barriers are not just individual, they're actually systemic barriers to educational, financial, and institutional opportunities as defined by the CDC. So, talent is everywhere, opportunity is not. So, the goal of this campaign in particular is to not only raise awareness of the shortage as a whole, but also to understand the diversity needs. And our goal is to target the underrepresented youth groups in the nation, ages 13 to 24, who will be pursuing careers in medicine, as well as the educators, policymakers, and admission leaders responsible for implementing practices and policies designed to diversify admissions into medical care. So, the message here is that representation in healthcare is essential. Our goal is to reach 100,000 people in 6 months and to inspire 10,000 students through stories and starter kits that represent their backgrounds and identities, as well as to work with 5 or more institutions to improve policies and diversity initiatives. So, since this campaign is targeted at young individuals, our primary method of outreach will be through digital storytelling. We'll use content such as physician stories, infographics through platforms such as TikTok, Instagram, and YouTube, which are the most commonly and readily accessible for most of the nation. And we'll also implement career outreach, virtual panels, mentorship, recruiting, and focus on Title I schools and rural districts that likely wouldn't receive this type of resource allocation if not. On an institutional level, this campaign seeks to work with institutions that are designed for diversity inclusion. So, historically Black colleges, universities, tribal colleges, Latin medical school associations, as well as medical schools in general for policy briefs and webinars to improve admissions, mentorships, and financial support to tackle this issue on a systemic and not an individual level. So, this campaign utilizes two main theoretical foundations. Number one being the social cognitive theory, where role models who are representative of identities boost self efficacy and the desire to potentially pursue a career in the medical field, as well as a framing theory, which shifts the notion of it being a personal barrier to structural issues that prevent people from pursuing medical careers. So, we show diverse doctors, we change the narrative of who belongs in medicine. And we plan to appeal through emotional, logical, and credible sources, such as health data by the American Medical Association, the CDC, emotional stories, stories of resilience and achievement through diverse doctors, and credibility. So, associations and institutions that back equity. So, to conclude, This is not just a pipeline fix. Our campaign is designed to break down real institutionalized barriers. The nation needs more physicians from everywhere that are for everyone. And this is a call to students, educators, institutions, policymakers to unlock opportunity, to amplify diverse voices, and to change the face of medicine now. Alrighty, well, that is all I have for you. Thank you again for taking the time to listen to me. And I hope this was informative for you.